My name is Evelyn Harvey. I'm a clinical neuropsychologist working at Westmead Hospital, one of Sydney's largest and busiest public hospitals. I have been using MEMORehab now for the past year. It's been a really great experience for our clinicians and facilitators and for our patients as well. We have been offering it to a wide variety of patients with neurological conditions. So that would include patients with epilepsy who might have undergone recent neurosurgical procedures. We've had patients with a variety of neuroimmunological conditions like multiple sclerosis and various other acquired brain injuries, whether that be traumatic brain injury. We've had patients with sort of recent cardiac arrest, for example, and even patients referred who are experiencing memory problems as a result of suffering from depression or anxiety. So a really wide variety of patients. The journey with MEMORehab actually began a few years ago when we received a research and education network grant to investigate the feasibility of running cognitive interventions like this online with participants. So we were lucky enough to run a group through the Memo research application. We built on that and had support from the Westmead Hospital volunteers to purchase our annual licence. They could see the potential benefit of reaching participants with the program in this way. And so over the past 12 months, we've then been running MEMORehab. I'm pleased to say that it's been going really well, and we have departmental funding to continue the licence and continue the program. We have also seen the benefit of MEMORehab in the return of activity-based funds for the program. So we may pay the annual license fee for MEMORehab, but then this year, across the 12 months that we've been running it, we are projecting that the group intervention will return for our department up to about $70,000 in activity-based funding. So there are a lot of things to like about MEMORehab. I'm a busy clinician. Resources can be limited, time can be limited. So offering MEMORehab is a great time saver for us. It cuts down the administration and the organisation requirements of running these sort of interventions with groups. And of course, it's fun. MEMORehab is a fun experience. As a clinician, I really enjoy running it. Our participants love it. The group dynamic is always wonderful to experience with them and to see them get enjoyment and support from others who are experiencing memory problems. They don't feel alone. They learn something, and we've had really great responses from the groups that we've run. It's an incredibly accessible program. So most importantly for our patients, it has the scope to reach people in a way that face-to-face encounters on the hospital campus don't. So we're able to offer it to patients in the convenience of their own homes in the online format. So this is excellent for overcoming significant barriers to accessing face-to-face care. Around health problems that might stop people from being able to get into the hospital easily, transport and travel limitations, the cost of getting themselves to and from the hospital. So that's one of the really great benefits of Memo. Beyond that, of course, it's beautifully structured and manualised. The resources are embedded in the web app. This is a great time saver for clinicians, but it's also very appealing to our participants who are able to access those materials conveniently in their own way, in their own time. The platform is very intuitive and easy to navigate, which I find excellent. It's great to have inbuilt reminders, both for the clinicians and for the participants as well, just to keep us on track across the group sessions as the weeks go by. And I also really like the fact that it's a combination of a clinician-led and facilitated group program, but also offers participants the option to do a little bit of self-directed learning. So they can dip in and out of the resources that are available for them on the app in between sessions to an extent that they feel comfortable with. They can engage more or less, whatever works for them. So I think that we are able to offer patients a sort of fairly sort of individualised experience in that way, because we work as a group, but they also have the option to engage with the program in a way that suits them. I'm a very keen supporter of fostering the growth of our trainees in neuropsychology. I do a lot of supervision work, and one of the benefits of offering Memo, of course, has been to provide this as an opportunity for students to learn sort of techniques in delivering cognitive intervention. I've had some good feedback from the students that we've taken through the program in this way, who have said that getting exposure to cognitive intervention work early in their training pathway has enabled them to then build on those skills and use that in their clinical encounters as they move through their postgraduate training. So being able to tailor strategies when they work one-on-one with patients, to sort of draw on the knowledge that they gained from working with participants in the MEMORehab program. So that's been really, really excellent, and certainly has furthered what I see is an important goal of getting clinicians upskilled and confident to do this kind of work, which is so meaningful for our participants.